Health authorities are working double time to educate the public about the importance of vaccination in order to protect children from vaccine-preventable diseases. Recent data from UNICEF show that 67 million children around the world missed out entirely or partially on routine immunization, and that was between 2019 and 2021. 48 million of them did not receive a single routine vaccine, also known as zero dose. The Philippines has over 1 million zero-dose children, making us the second highest in East Asia and fifth highest globally. How are local health authorities addressing this? Joining us now live via Zoom this World Immunization Week is Doctor Carla Ante-Orozco. She's the immunization specialist of UNICEF Philippines. Good morning and happy birthday to you today, Doc Carla. Thank you for joining us here on New Day.
Thank you, Dr. Freddy, and thank you for your greetings. And it's nice to be back.
Great. Now, Doc Carla, staggering numbers that we're seeing. Based on UNICEF Global Report, 67 million children have either missed out entirely or partially on routine immunization. What is the main cause of this? Can we credit this entirely to the COVID-19 pandemic, or is there really a pervading vaccine hesitancy?
Well, globally, if we look at the trend, even before the pandemic, there was already a plateauing of coverage of under-vaccinated children as well. But the pandemic really worsened this crisis. The pandemic years, 2020, 2021, and even 2022 saw the worst decline in terms of the zero-dose children. And this is brought about by many factors that would include conflict, crises, but at the same time, the restrictions, and then the focus on COVID-19 response and the COVID-19 vaccination even relegated the resources to just this response. And that has affected the delivery of essential health services like routine immunization. And that has contributed to the increase in the zero-dose children and the under-vaccinated children. But just to say also that the zero-dose issue is not just about vaccination. It is also an issue of multiple deprivations of a child, because most likely the zero-dose children are children also that are born of mothers that are not given appropriate prenatal checkup, probably not even born in the hospitals, and maybe stunted as well, and not not even having primary education. So it's really a crisis. It's a looming global crisis in the world, and that would also include the Philippines.
You mentioned how even before the pandemic started, nagpa-plateau na, bumababa na yung cases of vaccination for children. What are some of the factors that might have contributed to vaccine hesitancy or low vaccine confidence?
Well, again, there are also many factors, but we have misinformation that is prevalent because also of the advent of social media has also helped that. Contributed to that. There are also cultural issues, some religious issues as well, and sometimes it's not only the issue on the misinformation, but also access to these vaccination services. So sometimes health facilities are far from the parents or caregivers to bring their children. Poverty is also an issue on vaccine confidence and bringing their children to the health facilities. And at the same time, not only the reasons for the increase in the number of zero-dose children are really multifactorial. There's also persistent missed opportunities for children, so meaning there are less vaccination sessions, less outreach activities to reach them, especially the marginalized communities. There are also sometimes issue of less supplies of vaccines and other immunization supplies. And also, there's inadequate number of human resources or manpower to do the vaccination session. So it's really multifactorial. So approaching the zero-dose problem also needs, approaching these different components or different issues of the immunization program.
Right. I'll just reiterate what you just mentioned, because the recent UNICEF report also states that children in the poorest, most remote, marginalized, and conflict-stricken communities are usually the ones that miss out on immunization. What do you think, Doc Carla? What should governments do to make sure that they reach kids in these areas?
Yeah, so it's really a concerted effort, no? The government really is leading this and should be leading this. So that would mean investing in more human resources that would really cater to these marginalized communities. That would also mean investing in improved supply chains, delivery of vaccines to these remote communities, disadvantaged areas, and also increase investments in social mobilization, advocacy activities, to promote awareness on the importance of vaccines. And yeah, and also improving community engagement as well, and engagement of local officials to support the vaccination drives.
Thank you again for joining us, Dr. Carla Ante-Orozco.